Afternoon, everyone. I'm Stanley Brown. I'm the Dean of the Dalhousie Lana School of Public Health here at the University of Toronto. And it's my pleasure to start today with the land acknowledgement. So we wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. So I'm welcoming you today to actually the 4th annual Vohra Miller Lectures in Critical Public Health Issues as a collaboration between the Institute of Pandemics at the Dalhousie Lana School of Public Health and the University of Toronto. The Institute was formed to tackle some of the most pressing issues associated with the COVID-19 pandemic, but also the after effects of dealing with pandemics and the continuing sort of range of global threats that we deal with to public health. The Institute, along with its lead donors, the Vohra Miller Foundation, sponsors this lecture series that features, amongst others, scholars, policymakers, advocates, practitioners, all engaged in the science of pandemic-related activities and inequities, and in the translation of that science into impact. I think it's important to keep in mind that almost any plan to deal with the pandemic has to deal with the issue of controlling the impact of the pandemic and minimizing social disruption. And a critical issue during a pandemic is school closures, interruptions in education, and the way that we maintain social cohesion. Now, this afternoon's discussion, addressing the mental health impact of pandemic-related school closures, feature a panel of experts with different perspectives as they discuss the health equity issues, the impact of the pandemic school closures relating to the youth educational landscape. As a public health school, we recognize the importance of public health measures needed to ensure all Canadians are safe, but we also look forward to a discussion where we can reflect and analyze its impact in a meaningful way and how hopefully to navigate the next pandemic in a better form, although hopefully that's well into the future. Today's panel discussion will be moderated by Dr. Amy Gajaria, and it'll feature panelists Kuan Liu, Mark Lasso, and Kimberley Chau. And I'm grateful to them for sharing their perspectives and for continuing to support and participate in the discussions such as these. And thank you and welcome here today. But before we get started, I'd like to turn it over to Sabina Vohra Miller, the lead donor for the Institute for Pandemics, to say a few words.
COVID-19 has impacted people in a very inequitable way. Racialized and marginalized people have been hit hardest. Our foundation, the Vohra Miller Family Foundation, has partnered with the Dalhousie Lana School of Public Health to launch the Institute for Pandemics. The Institute for Pandemics takes a holistic view of the pandemic, focusing not just on the current crisis, but also on resilience and recovery, using health equity lens as a key driver. The greatest strength of the Institute is the intersectionality that is built from the ground up. We will be liaising with epidemiologists, infectious diseases, health systems, policy, economics, bioethics, and many more. The road to recovery is going to be long and hard, but it must be done in an equitable way. We absolutely cannot leave anyone behind.
Thank you so much for the introduction and those kind words. We're pleased to be here today. Our program today will include a roundtable with reflections from our panelists. We will ask some of the questions that were submitted in advance. We won't be able to get through all of them, but we'll do our best to answer the ones that we've been able to list. The event is being recorded and will be posted on the Dalhousie Lana School of Public Health and the Institute for Pandemics YouTube pages with closed captionings following the event. I'm pleased to be here today with a group of panelists. I'll start with the person beside me. This is Kuan Liu. Professor Kuan Liu is an assistant professor at the Institute of Health Policy, Management and Evaluation and the Biostatistics Division at the Dalhousie Lana School of Public Health at the University of Toronto. Her research targets the development of novel statistical methodologies motivated by applications in a variety of disciplines such as personalized medicine, population health, and health services research. So welcome, Professor Kuan Liu.
Thank you.
We also have beside her Kim Chau. Kim Chau was born and raised in Toronto and is currently working as a high school teacher. Her passion for mental health began through supporting others in their own journeys. She was diagnosed with bipolar disorder in 2018 and wants to use her experiences to help others see what life can be like living with mental illness. She has participated in 4 Jack rides in support of Team Bridget and 2 as a ride marshal. You'll have to tell me what that is later. When she's not working, she can be found spending time with her family and friends, enjoying new foods, playing ultimate frisbee, and most recently doing spin. And the next person beside her is Mark Lasso. Mark is a TDSB principal. He has been working in the school in instructional leadership, teaching mental health and school safety for over 30 years. And we are so grateful to have your expertise as well as someone who really is in the school system.
Glad to be here.
Thank you. And I am Dr. Amy Gajaria. I'm a child and adolescent psychiatrist. I work at the Center for Addiction and Mental Health. I'm also an assistant professor in the Department of Psychiatry and the Dalla Lana School of Public Health, focused in psychiatry and health equity research. So we'll start today with just a couple of remarks from each of our panelists. Each of them will share a couple of minutes on their thoughts related to the mental health impacts of school closures during the COVID pandemic, and also just the pandemic's effect on young people in our society. I can tell you, as a child and adolescent psychiatrist, I see this impact both during the pandemic and afterwards. It has had a profound impact on young people. We have seen such acuity and complexity in the mental health needs of the young people that I work with every day. And there's also, we were speaking earlier, there's a lot of grief and loss for young people that happened by losing really important parts of their lives, missing out on their graduations, their transitions, really, really essential components. And so I'm so pleased that we're here today to talk about this topic. And I'll hand it over to you, Kuan.
Thank you so much for having me today. I'm looking forward to contribute to the discussion today from a researcher's perspective. I'm excited to share some of the knowledge on what we have learned so far with some data and evidence from existing literatures. And what I at most looking forward to is discussing and learning from the entire panelists here to know that where we need more answers, where we need more data and more empirical evidence that as researchers we can generate, making sure that we are truly producing results that can inform equity-based policy decision-making, and whatever we are generating and working on truly meets the needs from families, educators, and care providers. So this is to closing the gap. And I myself has a more data science background. I'm a biostatistician by training, but since joining Dalla Lana and HPME, I opened my eyes in the world into public health, and I think there are a lot of issues that we should focus on, and what we're talking today is extremely important. At the end, I just wanted to take this opportunity to acknowledge my collaborators on this project that we got funded by the Institute for Pandemic Catalyst Grant. My colleagues at HPME, Jeff Anderson at Beverly at SUSE, and Jennifer Jenkins at OAZ, and a few other collaborators from the Queen's University. And we formed this collaborative research group looking to investigate pandemic-related education disruptions impact on kids' mental health.
Thank you so much. Kim, did you want to go ahead and share a few words?
Sure. So I'm Kim. I'm here representing the youth from jack.org. I have spent some time as a mental health advocate. Amy did introduce that I was diagnosed with bipolar disorder in 2018. I spent several hospitalizations at CAMH throughout the pandemic, so sharing my experiences as a youth going through mental illness as well as a high school teacher. So currently I'm teaching in the Toronto District School Board. So trying to figure out the gaps and also understanding. I started teaching during the pandemic, so completely virtually, and then seeing all the transitions that Amy has brought up, but a lot of the extracurricular aspects in the schools.
Perfect. Thank you so much. And speaking of schools, Mark, did you want to share anything?
There we go. No, thank you very much for having me. I think, as a few people have mentioned, recognizing that this was such a significant event, not only to children and youth, but society as a whole. This is a one in a generation type of experience, probably beyond more than just one generation necessarily. And understanding what happened, what worked, what didn't work, and as you said, what can we do to prepare better for the next time? And as sure as I'm sitting here, there's going to be a next time. But what can we do? What can we learn from this? And I'm very pleased to be among a group of professional learners and lifelong learners too, because we do want to learn from each other and the greater community as well. academia and healthcare and other educators, both at the elementary, secondary, and post-secondary level. There's just so much to learn, but there's so much we don't know too, because it is still new. And if we can build that knowledge, find out what do we know, what don't we know, and better prepare for the next time. That's some of my emergency planning background talking there. We learn from past experiences so that we can do better the next time. And that's one of the things that I want to do, and I'm really looking forward to that too.
Perfect. So let's get chatting. Speaking to kind of what you all mentioned, you know, we talked about mental health challenges that young people faced, and we also Mark just spoke about, you know, we don't know certain things, or certain things we don't know. And I wonder if we can talk a little bit about some of the mental health challenges that we saw kids facing due to the pandemic-related school closures. And I wondered, Kuan, actually from your background in science and the work that you do, if you wanted to share some thoughts on that first.
Yes, absolutely. So I want to begin by saying, you know, what we can infer from the data is only as good as the data we collect. And I think this has been echoed from multiple scholars and scholars from Dalalana, that we actually don't have good Canadian race-based COVID data. So when we're talking about the pandemic impact on kids' mental health, where generally the evidence and data we have are large population scale, but we should not have one summarization of data where we know that we have a diverse population. So I think from a researcher's perspective and sort of what motivated this project I'm investigating is to gather more information on where we're lacking. We do see multiple studies have consistently reported that adolescent girls and females have a higher rate of hospitalized and emergency visits, episodes of eating disorders, self-harm, but we don't have granular data to looking at these phenomena at race and ethnicity levels. So I would also love to hear from Kim and Mark at sort of the school level what they have seen and if that matches what we observe from a population level data.
And we also know from a large data study of student health that there was high rates of just distress, you know, psychological distress, well-being, that seemed to really go up as well as what you're saying. Did you have thoughts on kind of what you're seeing in the schools?
Well, self-identification, where kids have identified some of these distresses. And it's interesting you talk about the data sets and things like hospitalizations too. I think because of the significance of this event and the nature of this event, capturing the kind of data just from, say, visits may not be always the best way to do it, because a lot of the places weren't open or available, or the travel wasn't possible, or childcare was an issue to leave some to go to the hospital. Doctors weren't available, you had to do it virtually. So the whole process of how we would normally address, say, a malady or a mental health issue is done differently, or was done differently. So capturing that data to see how accurate it is, I think is going to be a big, big challenge. But if we can, I think it will be very helpful.
Yeah, you bring up a really great point, which is how do you even study something that's in flux? You know, we were all kind of moving on the fly, trying to figure out what do we do, what do we put implementation, and then you're now also talking about data. How do you actually look at a thing that is novel and new? And I don't know if you have thoughts or answers.
Yeah, I think that is such a great critical point, because using hospitalization estimates as a quantification of the extent of the problem, this is hugely limited, because I personally think it's an underestimate of the extent of the problem, because not everyone have access to care, and we know that from the literature. And so I think one of the population-based study had done in Ontario using ICES and health administrative data had shown that high-income neighborhood we do see higher number of virtual care uses in these neighborhoods. So that doesn't mean that there's more needs from that particular neighborhood, but just in translation that it's telling us more service users are from these neighborhoods. So data are lacking on that aspects to explain to us, is there a need or is there something more than that, what we're seeing with the phenomenon. So lots of researchers have been making effort to collect crowd-based survey data, which I think self-reported mental health outcomes are also important. So we have good large population-based survey data, but the Canadian Health Survey on Youth and Children, that one we don't have the data for the 2023 cycle yet, so it'll be a little bit difficult for us like scholars to use that self-reported data.
And data is so important, you know, as researchers and as folks that make policy, but also just like from lived experience, like you were in the schools, you speak about your own experience as a mental health advocate. I wonder what you were hearing from young people or seeing.
So I think the biggest thing too is like the number of interactions that students have that might get missed in terms of reporting. So with our students, we have a population of close to 1,000 students, but as the students talk to different people, they might be triaged to different places. So whether their first interactions are with their teachers and the teachers reporting it to admin, or we're very fortunate in my school to have the help of social workers and child youth workers and child youth care. We have very specialized care for our Black students. So that we have Black student graduate coaches, Black student social workers. So those are different accesses. And I guess as students get reported, those are some ways that we can see and hear more. So I think those are some big things.
And if you were thinking, you know, you're a teacher and there's a young person who's struggling with their mental health, would there be ways that you would know? What would sort of tell you this is a young person who might be struggling?
So I think observation and conversation would be the biggest, I guess, first insights, I would say. I think if you have students in distress, one pretty obvious could be like maybe appearance or ways that they're coming into school. A lack of attendance is a very strong, I think, indicator for us. I think those are some things that we take in. Conversation-based students are a lot more open about their struggles when you build a connection, so having and being that caring person to them, and when they disclose, making sure that you're bringing it up to the appropriate resources and people that can manage, and figuring out from there and having those conversations with parents and guardians as well.
Great. And from our end, on the clinical end, where they get to us, we'll see, you know, young people are struggling if they are not going to school, like you said, their school performance drops, they're more grumpy, they're more irritable, they might be losing weight if there's an eating disorder problem, might be using more substances. From our end, clinically, that's what we see as well. And then, I don't know, Mark, because you're also in the
it's
school.
noticing these changes.
Yeah.
Mm-hmm.
But noticing changes takes people to be there to notice the changes. So that's what's so critical about the role of educators and their knowledge base, but also just being available, being free and open to spend that time, to notice those things. Teachers, parents as well. So often we get asked by parents on how can I sort of tell what's happening? How can I tell if my child's having any difficulty? Well, look at changes, but it's that noticing, it's that relationship. Mm-hmm. Same with healthcare workers too, right? It's that bond and relationship. So having people available that, like great high school teachers, great elementary teachers, that can spend that time and have some of the base knowledge of what to look for, and then how to then make referrals or seek help on what are the next steps, sort of thing. But that's key.
And I think you've both kind of touched on it, but what would you think about how do schools actually, what's the role of schools in addressing children's mental health as a result of the pandemic in general? I know as a clinician, so many kids are accessing, you know, care and getting so much support from the school, but what's your perspective on, or anyone really, but
I just wanted to start this particular topic with the data that I found online. So I did a literature search, and then apparently there's a survey done indicating that 91% of kids at school feel safe at school. So this whopping proportion tells us that school plays an important role for kids. So this is the data that I gathered, and I think it's probably vital to think about interventions or promotions that we can do at school levels where kids feel safe and connected. Yeah.
Oh, absolutely. I think schools are where kids spend a majority of their time. Mm-hmm. Often teachers spend more time with the kids than parents for a lot of reasons. You can even up that when you're looking at some of our marginalized and vulnerable populations. And so it's critical that the resources and the knowledge and the opportunities be available so that schools and teachers can identify things like this, because when it's caught early, we know the success rate goes up that way, but it's critical.
Yeah, I'd say a big part is socialization. Like, they are coming to school, spending a lot of time with their friends, seeing teachers ideally as role models and people that they feel comfortable going to. It's a great space ideally for them to learn and open their mind to different things, whether it's learning new subjects or applying themselves in extracurriculars or different aspects. So having that sense of community and place to go, I think the safety is ideally what we're all hoping for in education.
And that stat you gave of 91%,
Yeah.
that's huge, and I think really speaks to what you're both saying. Like, school is such an important place for interventions. We did a project in Nicaragua. I was part of a research team that looked at implementing mental health literacy, especially in low-income and middle-income settings, because kids are going to school. And because you can access them there, you don't have to bring them somewhere else or get them access to the system. So if you were to dream big and you were to think, I don't have to worry about budget, I don't have to worry about any of that, what would it look like if you were to implement something in the school to support young people's mental health?
Well, schools right now are the hub for a lot of things on the social service level. We deal now everything from providing food to housing advice, employment, immigration, newcomer connections. So mental health, physical health as well too, but mental health is a key area. It's sort of the gateway into the services, especially for people that don't know systems, because systems are all consuming sometimes, even for people within those systems themselves. Mm-hmm. And schools have that important role. And I think probably supporting, but also understanding that is going to be key. And just I'm saying that, I forgot what you asked, just directly to that.
Oh, just like dream big. If you were to like,
Yeah.
you know, what would schools do either now or if there was a pandemic? What's the role of schools for kids' mental health? What would we do?
Do you want to go first?
You can
I
continue,
got 100 ideas.
Okay. I think it's coming down to asking them. I think asking them what they want, being able to fulfill all the clubs, fulfill all the teams, fulfill all the courses that they want with people that are passionate educators. I know sometimes it comes down to budgeting is a tough one that we're all kind of dealing with, but being able to, I guess, fulfill what they need, and whether it's those basic things like ensuring they have access to Chromebooks. That was something that was a big thing over the pandemic, was ensuring students had access to devices, making sure everyone had access to internet when they were going through virtual courses, making sure they have the food and have enough, I guess, basic resources, and then being able to be that space for everyone to enjoy.
You mentioned a good point around the choice, and I'm going to pull it aside a little bit and use the term voice. Mm-hmm. So the voice of students on what they need and want, the voice of communities. I think they have a very good idea of what they need from schools and what schools could provide. I know a number of years ago, one of the trustees with Toronto talked about schools acting as a community hub for a lot of services. And you see different elements or different incarnations of that in Toronto right now. We have, through the Model Schools program and partnerships with hospitals, we have access to developmental pediatricians, which then can be a gateway into different services that way. But there's such an opportunity with schools as community hubs on not only a mental health level, but a wider social service level too. And they're great opportunities and great avenues to access that.
Did you want to add?
Kim mentioned about providing Chromebooks as an example from her school and experience, and data that actually does support that. Well, even though only 1.2% of students in Canada that don't have internet access, it's a very small proportion. But this rate is much higher for low-income families, and low-income families are more likely to not have more than one device per member of the household. So there is needs, and if we're talking about, we're not thinking about the limited resources. And I think the government can certainly, or there's interventions, we can help the school to make sure that all kids that needed the devices and the equipment and facilities to assist with virtual learning gets it. And another sort of thing I observed from the data is that there's an increasing use of social media and online searching among kids. And so I think school can play a role in the pandemic, maybe investing more, I'm just thinking, suggesting like more facility building for green spaces, outdoor spaces. Should we have another pandemic going, maybe school can still operate periodically, or that works with the public health measurements, yeah.
And you all, oh, sorry, go ahead.
Well, you talked about technology, and especially around our more marginalized populations. Devices weren't just an issue, it was access to internet. So the funds and how you sign up for that, where you know, it's just not sort of always pay as you go. Having the infrastructure for that, having the technological awareness to be able to use the devices. And how do you sign in? How do you sign out? How do you get to this breakout room? How do you do that? So you're talking to families that English is not their first language, newcomers, you're talking families that perhaps there's no adult there, but maybe an older sibling, and so just being able to get them online and keep them online. There were a lot of complications just around devices themselves. So there's just so many different parts and pieces to this, to the whole palaver in a way of what happened, that just being able to piece through it and go through it and look at what worked, what didn't work would be so interesting. But I know we're still in early years too. So.
And I think you all bring up a really great model, right? You start by asking young people and families, and then you go up to schools and you say, you guys do this work every day, what do we actually need? And then you start thinking really big, like Kuan mentioned, which is designing the system, thinking about access to technology, changing the way we actually have schools and making them have more green space. And you all mentioned a couple of times thinking about, you know, underserved populations and the kinds of populations that were really hard hit by the pandemic. You know, I'm very, very privileged to work mostly with Black and Indigenous young people and to work in parts of Canada that experience a lot more poverty. And those young people had so many challenges, exactly all the things that you've said, but then their parents were also the frontline workers. So there was both the challenge with accessing the virtual care, but also living in places where their parents were leaving every day. They had to go and work, and they were living in apartment buildings, or they were living in the north where internet access isn't as good, or we couldn't do fly-in care anymore up to the north like we had in the first years. So there was a lot of impacts on marginalized, underserved communities, Black and Indigenous communities. And I wondered if any of you wanted to speak more. I know, Kuan, you've mentioned some stuff about that in your data, and I'm so glad you brought up race-based data because it's so important. But I wasn't sure if anyone else wanted to share anything.
Did you want to speak with individuals?
Sure, yeah. So individually based, at least at our school, I find that with our students, it's a lot of like individual care. So I think it's high needs in terms of one-to-one support, whether it's their parents that aren't at home or whether it's just a lot like big families having those individual pieces that I think people need those places, again, like I said, to be safe and feel like they need to be heard. They need to have those strong connections. They have to want to come to school, seeing their friends there, being those places of encouragement. And I think that's something that's changed a little bit over the pandemic, or at least within what I've seen in my education.
Yeah, it sounds like you're saying that the school environment may have changed when kids came back.
I think so, and I think it's very dependent, and I think Kuan brings like a really interesting perspective, saying that her data set comes from what she's observed, and similarly, like I get to see a very unique school and unique needs, and depending on how it's spread throughout the city, I spend a lot of my time centrally at one place, but observing what else might have gone on in other communities and neighborhoods too.
Yeah, the pandemic was experienced very differently by individuals and by different groups of people. And at the schools are in a good position to be able to identify some of that on a local community level. So having that voice there is important, not just of the individual students, but of the community too. And there's an opportunity then to have more of the ideas of what works for them and what's impactful to them and what's effective for them. And having the ability to change it quickly as a needs base, and that's hard within larger systems, But schools, again, can be very responsive to that at the local level. And as we all know from disasters, the recovery of disasters always starts at the local level, right? That's the starting point. And so I think this is really no different. So if we look to the local communities, look to the individuals, look to some of the leaders and the voices, and the voices we don't hear too. You know, that's an important part when we talk about data, is we can't just look for what we see, but we have to look for what we don't see. We have to listen for what we don't hear. And that's really how we get at the more marginalized and vulnerable populations, because that information can tell us a lot. Because those are always the groups impacted the most in situations like this too.
Yeah, I 100% echo what has been said. The remote communities have been majorly impacted, and many ongoing programs they have been halted during the pandemic because of social distancing and other consideration on the public health front. And so it's documented that Indigenous youth are at risk of leaving school without support due to pandemic, because these programs have been held and stalled and now reinstated, but there is a gap. And parents of Indigenous youth are worried, extremely worried about their kids' success and prosperity of the future, because we know that the Indigenous community have a higher unemployment rate. So these are things we do see from the data, but the data doesn't tell us enough. And I think working with individuals representing these communities is crucial. So that will also tell us where we should look for more data and collect more data and design the study that works, that gather more information on areas that we truly do need more information on.
And there can be some of this conversation about, you know, an over-focus on EDI. People will say, why are we focusing on diversity or marginalized populations? We need to focus on everyone. But I think, you know, from my perspective, what you've all said is, I see that is how we know when a system's not working. Because the people that are most affected are often our most marginalized people, and they're really like kind of the canaries in the coal mine, right? They tell us, these are the deficits in the system. These are the ways in which our system isn't working. And so it's really essential to understand that for everybody, not just for those communities, even though I think those communities are extremely important, but they're also important to the larger system. Okay, I was going to say, so another big question. We've talked about some challenges in terms of, you know, who really suffered with the pandemic. The other thing that I noticed clinically was kids with ADHD, neurodevelopmental issues, learning problems. I would never have known this, but they did really poorly with virtual learning. And those kids seemed the most vulnerable to kind of falling off track. So thinking of all those populations, kids with different learning needs, remote and Indigenous communities, racialized communities, people experiencing poverty, again, you're going to solve the world. What could we do to make things more equitable in terms of access to mental health care for all kids?
I think looking at the baseline. So in other words, what do we provide all schools? So what kind of supports and services right now? What type of staffing do we provide to all schools? So if we're looking at it from an equitable lens, or a lens of equity, we need to have substantial services right across the line, and then that gives some flexibility to increase the needs from on an equitable level of where the needs are higher or lower. In Toronto, we have the Model Schools program, and that's adjusted depending on what we call the Learning Opportunities Index, specific to Toronto. So they look at key communities, key areas where the needs are higher, so they get increased staffing, increased funding. But that's flexible. It's reevaluated every 3 years as well too. So models like that, so having good, strong general resources as a baseline, and then increasing where the need is, looking at a number of different pieces of data, whether it be quantitative, qualitative data sort of thing, observational, feedback from the community, feedback from educators, feedback from parents, feedback from the kids. So important.
I think it's tying into their personal interests. I think I have one student who just kind of mesmerizes me in a fun way. but he's part of our mild intellectual disability program, but he's found his little niche in Roblox and now has his X amount of followers, and he found his little thing that speaks to him and kind of excites him. So if we can figure out kind of if these are smaller groups of individuals that have the higher needs too, it's figuring out what speaks to them, how we can engage them in ways that are meaningful, and whether it's through like media or through books or through different things. I know something that's kind of fun and exciting is always like fire trucks and different things. So seeing things sometimes from a lens where they're seeing things that are new, things that are more gamified, so focusing on play and things that are novel, I think are fun ways to bring in something sort of different to education.
Yeah, so I'm going to speak a little bit more from a system level. We know that the needs of mental health services has not been met pre-pandemic. It's just the gaps have been exacerbated during the pandemic. And so we have heard stories of long wait times to get their first mental health services. It's on average about a month. That's based on a study that published back in 2020. And sometimes 10% of people wait more than 4 months for access to their first mental health services. So I think at a system level, we do need more fundings to make sure that we can reduce the wait time, reduce the waiting list. And so that kind of system level allocation of resources is very important. So another element I think being brought up earlier from the discussion is that we also need to provide mental health support to the caring adults, to the educators, to the parents who need them, because at a family and a school environment, these mental health stress can be projected to kids and can affect their learning indirectly. So these are key areas on the service level we should also focus on. And I think sort of what I learned through doing research, moving from more like a data person, quantitative, to now thinking about generating meaningful work, is we need to focus on knowledge translation. I think involving kids and educators in part of the designing of the study, involving with what we're trying to get more information about, and have them like co-design the program if it's going to be a policy implementation at a grassroots level. I think these are all like wonderful ideas and we should strive to do. And I think some efforts are under the way. But of course, it's diverse. We have a diverse population, and geographically there are variations as well.
And I think what you're all saying is this is a great kind of group to come together to solve these difficult problems. I think in our system often we're saying, oh, let's have teachers implement things, let's have educators do their own thing, scientists do their own thing, but it sounds like maybe what you're saying is everyone needs to come together to think, how do we build a flexible system that really speaks to the individual young person's needs, like you're saying? Do we have room in our system that if a kid loves a fire truck or wants to learn in a different way or has a specific interest, we have the space to do that? And it sounds like you have a great understanding of that policy level, and
it has to be integrated.
Mm-hmm.
That's so important. We can only get a good understanding of how the pandemic has impacted children and youth mental health until we understand how it's impacted the adults' mental health, the adults that care for them, the parents, the educators, the healthcare workers, the community members, the faith leaders, the cultural leaders. These are all important people in children and youth's life, and it's had a great impact on them. And you're seeing that trickle down. You're seeing that projection. Families losing their home, losing work, losing individuals. The whole change in their lifestyle routines, that is pushed down onto the kids. So when you change things like that, you have the anxiety, you have the lower frustration or tolerance, you have the irritability, all the other things that can happen, the less socialization, difficulty interacting with individuals or solving conflicts. You're seeing all that come through. And as I mentioned just before we went on air here, is I talk about that gas tank. So the pandemic took some of the gas out of our gas tank. It took more from others, from some than others. And as adults that are supporting the kids and youth, if you're going with less gas in your gas tank, it's harder for you to provide that support, to go the distance. So you're starting off in a deficit perspective already. And so understanding how it impacted adults will also help us understand how it impacted the kids, because parents, first and foremost, are the kids' most important and first teachers, right? They're the caregivers. They're the ones that notice the things. So I think integrating things, but also cross studies of pandemic impact is also important as well.
Yeah, and I think that's exactly what we say in children's mental health as clinicians. If parents are not well, kids are not well. And kids are so good at picking up all those tiny cues in the adults in their lives. Their behavior will change, and you'll say, how are you doing? And they'll be like, they don't know, I don't talk in front of them. But if you're stressed, if you're having a difficult time, then it really does affect the young people. So how do we support parents and families in supporting kids?
Just as a first point, there's two great organizations in Ontario. It's School Mental Health Ontario that can support educators and parents in regard to resources, and Children's Mental Health Ontario. So those are all available online, and they have a dearth of resources and connections and how to access help. Questions to ask schools, questions to ask caregivers, questions to ask healthcare workers and the healthcare industry as well too. And those are two great resources. But schools, as we talked before, is a hub, as a sort of a clearinghouse, as a first point of contact, are great avenues as well too.
Yeah, I'd love to take the time to share a little bit of, I'm representing jack.org here, but they've done a lot of work, and they started way before the pandemic for the needs of someone that died by suicide, but creating a space where conversations about mental health, mental illness are things that we can normalize. And with all the work that they've done, they've taken research, they've applied it, and created they created a certification where people can go through modules and can learn. So taking their 5 golden rules is what they call them. So being able to observe and how to talk to and how to take care of yourselves. So that's something that's free and accessible for youth to do. They've created an education hub for teachers to be able to access that's embedded with the Ontario curriculum. So those are some small resources. And they also do a great job and listening and bringing on youth across Canada. Their programs in English and French, as well as they do remote opportunities for Indigenous youth in Canada as well, but having free opportunities for youth speakers to go either to schools or to the community and being able to share stories in that way.
Great. Is there anything else that you can think about for parents or families? It's also okay if not.
I don't really have too much to contribute, but I think what I've been been shared is wonderful, because oftentimes vulnerable population intersects with racialized and Indigenous community. It's not like just one group of subpopulation. It's everything is intersected, and then you have vulnerable communities and families that fits multiple categories. So I think having, speaking, I am an immigrant myself, even though I don't have kids, but I think having services that are culturally appropriate and can, serve the community what they, the language they're familiar with, and these would be great great opportunities for us to invest. Yeah.
So I hear lots of really great resources at jack.org and the websites. There's also anxietycanada.com, which has great resources as well for families.
Some of the children's hospitals, like Sick Kids, CHIO, McMaster, they have different links on their websites as well too. And something we mentioned earlier, we talked about social media. And over the last few years, there's much more awareness around mental health, even within youth, even within children. And so their primary source of access is through social media. And there's been great information shared, but the other side is there's also a lot of misinformation and disinformation and malinformation that's coming through social media as well too. And that's one of the challenges in regard to an avenue to build education, to build awareness, to build supports that you can help yourself, also have to come with a lot of warnings, because if you're receiving it through things like social media, There's a lot of very problematic material on there and dangerous material on there too. So it's a big challenge.
Yeah, and we also hear, and I've seen in our research data and also my experience, that there's a mismatch sometimes because kids are getting so much information in social media. It's a different culture, it's a generational shift, but parents don't always have that. And so it's also hard for parents to know what is misinformation, what's out there, if we're not also giving parents that easy information.
And that's a great role schools and teachers can fill, because that's a very trusting relationship for most families. So when you have questions like that, they'll go to the teacher, they'll go to the school, and they'll talk and they'll ask questions, and then we can redirect them to solid information sources and reputable information sources.
Excellent. Anything else anyone wants to add?
I think we kind of touched around it and we brought it up a little bit, but it's that health literacy piece. And we said navigating the systems is difficult. And as someone who's been through education and thought that I knew how to advocate for myself, being able to ask for help, I think, is being probably the most humble first start. It's probably the most difficult thing to say and difficult thing to do, but being able to figure out where that safe person and reputable person and trusted person is to go.
Yeah, I hear a lot from everyone about this idea of we have to make it safe for kids to know that they can actually just say, I don't know, I need help, I need support, but then also give everyone the tools to know how to respond. So people don't feel, parents don't feel they don't know what to do, schools don't feel they don't know what to do. I have a question that I don't know the answer to, so I'm going to ask this very smart panel. Some people have proposed bringing back grade 13 to Ontario to help kids get caught up socially and academically. What are your thoughts? I don't know the answer, so I'm interested in your thoughts.
High school teacher?
So I would encourage any of my students who don't know what they're doing to take the chance in high school, because I think it's a safe space to take extra courses before you go on to college, before you go on to university, before you take on maybe some of those financial burdens of that uncertainty. But also, even if maybe you're on an academic track and you want to try something in the trades, there's a lot of schools, technical schools, that have programs that are really unique that might pique a curiosity that you may not necessarily get. So at my school, it's really fun and really cool that they have access to automotive and plumbing and electrical and hairstyling and culinary programs that some academic collegiate style schools may not have. So I don't know what the answer is from the ministry to bring it back, but I would say if the students have access to take the time and explore whether that gap year is facilitated in a school or whether it's in some sort of learning capacity on their own before pursuing things that are a bit more permanent, then I think that's a fun answer, fun option.
Great.
I always work towards schools that are safe places. Small communities where you know each other, you take care of each other. You don't always get along, but it's like a family. So the more time youth can spend in environments like that, and I don't know if necessarily going, because post-secondary education isn't for everyone. Not everyone's going to go to university or college or trade schools necessarily. And that, again, depends a lot on social vulnerabilities as well and the communities that you're in. But schools offer so much, and any extra time in my book spent in schools is always a plus that way. And kids will go through at a pace they're comfortable with if they have that option. Again, that's where the student voice comes in. Kids know what, not necessarily all, but kids know often what's good for them and what's not, or what feels right or what doesn't. And the more we listen to them and give them the options and the opportunities to go fast, take it slow, I don't think can ever steer us wrong.
It sounds like you're really talking about the idea of it being optional. So you have an option of another year, of a way to make your education work for you. That sounds really lovely. What would you say to kids who say, because I hear this all the time in my practice, kids are in a rush. They're like, well, I need to keep up with my peers because they're so social, right? They really want to do what their friends are doing. There's a lot of desire to fit in and be like all the other kids. And if they're not doing things at the same pace, people will say I'm failing, I'm doing something wrong. So if it is optional, if it's kind of your choice, do you have thoughts on what that would be like for kids? Or how we support them in terms of
making the decisions that work for them?
I think in hindsight, as an adult-ish, I would say it's easier to take the time and try to figure out, like you said, what works for them, trust, like give them a little bit of trust in what they want to do and what they want to experience. And in a great point, it's not just the academic structures that are in place. Maybe there's different resources that they may not have accessed previously, or maybe there's other clubs or different things they haven't tried. I'd say growing up, you don't need to rush. I think by the time you make it to adulthood, the numbers kind of blur together and you realize everyone is at their own pace. And I think maybe that's me proving, or I guess thinking into my future, but I think they have a lot more time than they give themselves credit for.
Yeah, school isn't just for academic growth, it's for social growth, it's self-awareness. There's so many different pathways of growth that occur in schools, and I think we have to be aware of that too. And kids will grow and develop at different paces in different areas. We certainly know that as an educator, and giving those opportunities, having the different pathways to get there. And then again, that brings in the element of being a more inclusive environment, more responsive to the different communities around you, whether it be children with or youth with disabilities, from different backgrounds, different cultures, things like that. So different things can move at different paces, and it doesn't always have to follow the same pathway. So options are always good in this regard, perhaps another year or different options within that as well.
And I think if the kids want to do one more year and then they decided to continue or going to universities or continue with their education, I think from the post-secondary institutes can certainly reassure students how the additional 13th grade is being evaluated. I think there's a lot we can also do on our end to make sure there's no such concerns or worries that they are not catching up to their peers, or any worries that they would be seen differently compared to those who didn't do one additional year, which I think it's very rare in Canada. But certainly I think there's a lot we can also do at university level.
Excellent. Well, we talked a little bit about listening to communities and sort of saying we need to hear what communities have to say. But what's the role, do you think, of community in supporting kids' mental health? How do communities do that? What's their role?
It takes a community to raise a child. We know that, right? And there's a lot of good data saying that the more caring adults that are involved in a child's life, the more successful that child is. May not necessarily be academic, but socially, just growing up as a person, being a good person, caring, empathetic, a good citizen, cares about each other. So the more adults we have, and the more then as a system we can support those adults that are key in kids' lives is so important.
Excellent. Anything else we need to think about at a community level? So policy, structures, systems. I'm thinking of some of the things you said earlier, which is like maybe it's also healthy and safe communities, like thinking about outdoor spaces to play and community safety and access to food and grocery stores in certain communities. But anything else that we can think of that maybe communities can do to support young people?
Yeah, I think the options are endless and limitless in terms of what communities can do. I think as long as we're trying to bring each other up, I think that's something that we hopefully are striving for, to build the best for each other, build the best. I think we keep coming back to safe spaces. I think representation's a big thing, so seeing people that you look like that are strong leaders and people that you can go to and that you can trust, trusting that people aren't burnt out. I think we keep skirting around it, but that big burnout piece, I think, is kind of what is limiting sometimes, not having the time or the energy or perceived time and energy. I think all of us have the same hours in a day, but how we allocate it and prioritize things that are important to each other and really trying to take care of each other.
Yes, so from a system level, I think communities is the place to conduct outreach. And I think all the programs that are available at the communities would benefit from more public exposures, health promotion, and having these kids and families be aware of these services. I think school definitely plays a key role in connecting the dots. As I mentioned before, now with the virtual learning since the pandemic, we have moved back, but some universities are still providing virtual learning courses, and the increasing use of social media and mobile devices or computers. I think this is ever urgent to have more like facility and green spaces where we can increase kids' outdoor activity times. And the duration they can enjoy the nature and kind of have like activities they can do outside of their home. And I think communities where individuals have more trust in, and certainly I think the researchers, us and policymakers, we have to do more. And I mentioned before, I think all the research we do, and especially the programs even at community level that are created should involve youth. So their voices are heard, and so in these process, if we engage with them, incorporate their voices, we gain trust through the process. That's how I see it from a more like a public health research perspective.
Anecdotally, during the pandemic and after, I had a number of community members that connected with me to say that the community grew, or the connectedness grew during the pandemic because very little was open, but the schoolyard was. And I actually, on my campus, I made a point of keeping our schoolyard open. And so families came, they talked to each other, maybe from different buildings. I had adults playing games on the field. We had people coming and working out because the gyms weren't open, sharing information. Some families actually had a little too much of something. They shared it with others. It became almost a little marketplace at some points, talking about sharing childcare because stores weren't open necessarily, or the funds to buy things online wasn't there. So the barter and sharing, or my kids have grown out of this, is this available? So communities emerged where there perhaps weren't communities. And schools then sort of facilitated, or school locations sometimes facilitated that, at least in my area, in the downtown core too. I'm also fortunate where I live and work in the same community. So during the pandemic, when everything was shut down, I could actually connect with a lot of the families and the kids. So when there were problems, I could actually see them face to face. I could keep an eye on some of those families that we don't necessarily see, or may need a little bit more extra help. But when you talk about community, supporting the communities through facilities, funding, spaces, access to information, even our small community being close to Hospital Row here, when we didn't get information that we needed about COVID, we talked to some of our parents who, we have many healthcare workers. We talked to connections we had at Women's College, or Sick Kids, or Toronto General, or Mount Sinai, or St. Mike's, to ask some of the questions that we had. Public health, our connections there was fantastic as well too. So the community element helped us survive and somewhat thrive in certain areas during the pandemic. And so promoting that, I think, is key in whatever form that takes.
Excellent. And I think, we hear, similar to what you said, if we look at the literature, we see that often mental health and community building actually can sometimes improve during disasters. Unfortunately, it's after the disaster. And I think what we're seeing is that then people splinter apart. They're left on their own. The people who were affected more really are left with that grief. And we talked earlier about we haven't made a lot of space for young people, or even families or parents, to talk about how much there's grief and how much we've lost. And so on that note, what are some of the long-term impacts, do we think, to young people from the pandemic in terms of their mental health?
I think some of those social emotional milestones we've brought up, I think, are things that they'll never get back, and those key moments where maybe their lasting memories of elementary school might not have been so positive, but then making big transitions to middle school, and for us, seeing a lot of our students missing middle school, jumping from elementary to high school, is a drastic difference in terms of socialization, in terms of structure. So things that are missing there, and missing graduation or prom, I think those are, sad things, but also the loss of, if there's loss of family or loss of any connections that they had built, I think those are more difficult things that they could have leaned on community had they been more socially connected. I know, at least when I started teaching these, I think it was phys ed and dance virtually, and so I was teaching classes to black boxes of students that would never turn on their cameras. So it was, how do we integrate that, and how do we make the transition of facilitating education but incorporating like group projects together? And so seeing the innovation sometimes too, where they went from unfamiliarity behind screens and not interacting to realizing, oh, okay, we ran across our classmate at the same park because they were on the same break. So Mark saw it when he facilitated it on his school campus, but seeing students meet each other for the first times, or seeing each other, kind of how we came together for the first time today to see each other in person, we're like, oh, right, this is kind of that social connection that we kind of need.
Yeah, it sounds like you're talking a lot about some of those losses in terms of social skills, emotion regulation that you get from being in school. Just as you've mentioned that school is such a hub for so many things, it sounds like we also forgot how much it's a hub for that, for learning how to grow. I think you said that, Mark. It's a place that we learn how to grow, and kids lost that at that time.
The soft skills, right? That you don't necessarily think of for survival, and just interaction, human interaction, are missed. And how do we get that back? We will get it back. It may be slower. It may take more resources, a little bit longer. Maybe perhaps direct instruction in some things, a lot more experimentation. But I think it's going to be somewhat compressed, or it may have to be in some way. What's the impact of that going to be then? These are big questions, and again, it's early days. But I think two things you mentioned. One is acknowledging the significance of what happened and the huge impact on society as a whole, and then what did we learn from it? What worked? Because there's some great things that worked out there that were just fantastic, and there were some things that were awful. What worked? What didn't work? And then what can we do better next time? Or anything similar related. Would we go online? Is there a different way to learn online? Is there a different way to learn that we can still stay connected but still be safe, depending on the situation? That's what I really want to learn about and find out.
Yeah. And from an academic perspective, as I mentioned before, we need more data. So it's ever important that we do have the resources and ability to collect longitudinal cohort that will be able to follow at a population scale these mental health impact extends over time and over years. And certainly our team look forward to use the 2013 release of the Canadian Health Survey on youth, on children and youth. And so with that, a particular survey, then we can compare to the reported, self-reported mental health status from the 2019 survey to see, now that we are in the recovery phase of the pandemic, how does that data compare to pre-pandemic, during the pandemic, in the first wave, second wave, third, and onwards waves. And so these are empirical evidence, I think, are also very important. Of course, there is gap, but efforts should be made into making these data set also accessible to researchers. Yeah.
And as a therapist, as a mental health therapist, I love making space for feelings, processing, taking time to take stock. And I think exactly like you said, we haven't stopped to do that. We haven't paused to sort of say, this major thing happened. Let's first of all acknowledge it and talk about how much it affected us all. But yeah, let's think about what went well, what didn't go well.
And you need to be intentional about that too. Mm-hmm. You can't just let it happen.
Mm-hmm. So what went well? What did we do that was good, or what came out of the pandemic and with school closures and all of that that was good for children's mental health we want to carry forward?
Anything you noticed from a classroom perspective?
I think we don't give our students and youth credit enough for how resilient they are. I think they as a generation, I'm going to say they as in I'm not the same generation as them sometimes, but what they're going through in life in general, pandemic or not, is already a lot to ask of youth, and as to add something that significantly changed the whole world. I don't know if there's really that space to process. I don't know if we've really taken the time to address it. I think we've worked through it. I think our calendar works on a 10-month calendar, trying to get it started, get it done, and kind of we pause sometimes in the summer as teachers to kind of relax and figure out what we need, and then maybe we're just picking up and going back again. So if we're having those conversations with our youth, maybe it is time to reflect and see how they manage things a couple years back, how they're managing now, what their future challenges that they foresee might be, and bring in, I think, experts in the field, and even if they have community resources that are knowledgeable that they can connect with in those transitions, either in the current grades they're in or post-graduation. I think having community and space and places to go.
Okay, what else did we learn that was good, that we want to carry forward, that we want to say, let's say, this ever happened again? What went well?
I think our adaptation to things was a success for the most part. It happened quick when you look at what was expected and how fast it was expected. For these big systems to respond as quick as they did, and for the most part as well as they did. However, that being said, many of the vulnerable communities were left behind in some of that. So the success is muted somewhat. But the pathway is there. Keeping a focus on the vulnerable communities, I think, is key. So having that those dedicated eyes in situations like that to make sure everyone is included in any changes or adaptations, I think, is important. I think another area of success was community. I think in many cases, and in different forms, community got stronger. People came together, and that tends to happen during critical events. Not all the time, but I saw many examples of it that really helped the resilience of individuals and families and communities well too. And I think if we can mirror some of what worked in those two areas and build on that, make them stronger, I think we've got some pieces to a stronger plan for the next one.
Yeah, and I would contribute less thinking about what we did good, but more like what we learned that we can carry forward to the next pandemic if it happens. I think evidence has told us that school closure has impacted mental health outcomes in kids and youth. So efforts would be made additional efforts besides school closure to make sure school is a safe place for kids, and that would include distribution of personal protective equipment to educators and kids at school, and have these social distancing being implemented, all the venues that better air qualities, fluctuation in the classroom. So all these other additional measurements we can put in place ahead at the early stage of the pandemic, so that we can maybe have a more dynamic, flexible model of school closure that doesn't need to last an extended period of time. So these are valuable lessons we learned from this pandemic, and I think what we learned is it's of great value. Yeah.
And I think for me, it was really saying, people always say, we can't do this. The system is too hard to change. We can't make these shifts so quickly. I know in healthcare, we talked a lot about virtual medicine before then, and there were always roadblocks and policies and things that were in place, and the flexibility with which we were able to respond when we really had to suggests that actually we can make big changes. We can make them quickly and nimbly, and perhaps that says there are ways we can solve these big problems. It's about our will and our commitment and our desire to do that.
Yes, if anything, the pandemic proved that we can make significant changes in systems we didn't think would happen if there's enough will. Mm-hmm. So that is a challenge to leaders. in education, in government, in the community to say, hey, this is possible. We need to build that will. We need to make this happen.
Yeah, it sounds like a bold vision. You know, people are often afraid of that because we're all exhausted and burned out and grieving. But
change is scary in itself.
Yes, yes, but it sounds like we're saying there's really a need for that. So, okay, let's say there is another pandemic. Many people are saying, you know, it's inevitable. Hopefully, it's far off. What would we do? What would we do to support kids' mental health should there be another pandemic? You've mentioned a couple of things in terms of, you know, making sure there's PPE for teachers. What can we do infrastructurally to keep schools open, having spaces where kids can learn outside? What else do we think we'd want to do or we'd have to do to support kids' mental health better in the next pandemic?
I think having a good, strong framework to begin with. Like have the bones there that are solid. Good resources, good people, good training, good education, good connections, good relationships. If we have a strong framework, a strong base, then that base is a lot more flexible and able to adapt no matter what is thrown at us. So I think that's really important.
Yeah, people have asked me a lot about children's mental health during and after the pandemic and the children's mental health crisis. And I said, we were in crisis before. The children's mental health system was in crisis, the rates were already going up, and so we were a system that it was hard to respond because we were just running on empty gas tanks already. We didn't have gas in the tank. Yeah, anything else that we kind of would want to do next time in terms of kids' mental health?
I think a key important piece that was maybe haven't been talked enough, and we should certainly talk enough, is early prevention. So school is certainly that place. So if we can reduce the higher rate or risk of someone having a clinical diagnosis of mental health that require healthcare uses, which that gets into the next level. And I think the prevention piece is really critical. Because we can, you know, there's not unlimited resources. There's limited resources we can do in allocating, you know, by providing more services. There is certain limitation, even though I don't want to admit. But so this is ever important at the prevention level, promotion level. Kids, we remove stigma about mental health problems, so people are more open to talk about it, especially young people. And I think peer support and community support is very important, and so they know they're not alone, and that it doesn't get aggregated or aggravated or progressing into a more severe stage.
Yeah, I think a little bit systemically too is ensuring that everyone has connection to a basic healthcare person, whether it's a family physician or someone they can access as that primary person to go to. If people have the resource to access therapy is so expensive, but there are sliding scale ways of potentially connecting with someone semi-regularly and creating that baseline support, almost like a care plan. So figuring out maybe if someone's stressed, that's kind of their self-care stage, but if they're moving through like a struggling and a crisis space, like how do they navigate those different places? So making sure everyone kind of has those foundations and can figure out where to go if and when things become a struggle or crisis.
And any kind of base framework or plan also intentionally has to have a focus on the vulnerable groups and the marginalized groups. It has to be intentional. It has to be pulled out separate because the need is so great. And they're the ones impacted so much. So I think that's something that we need to do for the next one as well. Look at what worked to support those communities here and make sure that that is a piece of whatever we have as a base framework or as a plan going forward too.
I think about another big system thing that we did was ensure healthcare for everybody. So I tend to work, in one of my clinics, I work with a lot of people that are uninsured, don't have OHIP cards, and the access to care for them is so difficult. And they're some of our most underserved people. And during the pandemic, people could access care, emergency care, even without OHIP coverage. And that made a huge difference, not just to clients, to getting access to care, but also to the health system. Like, we didn't have to stress, and doctors don't really want to worry about finances and can someone pay, like you just
Fill
want to
out the
provide
forms
care.
and-
Exactly. So it really actually made a difference. That again was a nimble and quick change that really made a difference for people.
Yeah, what can be wrong with providing services like that as easy as possible? Right? You're making for a healthier community, a better educated community, a more connected community. That the payoff, is fantastic down the road. So if you just look at a financial perspective as opposed to just how much it makes the society better, the payoff is there.
Yeah, I think this is always the struggle we have in these systems. Is if we're feeling burnt out, we're feeling exhausted, we're feeling tired, or we're feeling our system is stretched, we get into this response mode. Let's just put Band-Aids on everything. And really taking a step back and looking at prevention, looking at system design, looking at stopping problems before they get really complicated is actually a move, but it can feel really hard to do sometimes. So we're in our last few minutes. It's been so wonderful having this conversation with everybody and coming together and putting our heads together from different areas and fields and thinking about, kids and their mental health, and even just reflecting back on all of the things and kind of that fog of, the last couple of years. I don't know if there's anyone that wants to sort of closing things you want to say, things you didn't get a chance to share, any other reflections you want to share to folks as we come to our close.
Well, you're all looking at me right now. So,
we're all staring your way.
I think it's something I mentioned before. I think we really need to acknowledge the significance of what we went through. And we need to take accounting of that. And that's what I'm looking forward to. And I'm hoping it's going to happen in some way, that we can look either sector by sector or area by area and look what worked well, what didn't work, and what do we need to do for the next one. I'm an educator, so I'm always learning. And so that's where I go automatically. What can I learn from this, and how can we make it better for the next time?
Yeah, I think it's definitely asking those tough questions. Something that kind of like percolated things that I was thinking of that we didn't bring up is looking to maybe other countries or places and what worked well outside of Canada, or what worked outside of Ontario and Toronto, and seeing kind of what succeeded, maybe when we're talking about the pandemic specifically, but looking to other areas as well.
So being more broad, saying like, let's think about other models, what are other people doing well? And not just high-income countries, but also countries that we would not necessarily think about too. Yeah. Kuan, did you want to say anything?
I think I kind of mentioned everything I want, and I guess my overall theme and goal, what I'm preaching is that we need better data, and data provides more insight, and we don't have that data from communities, or we have limited data from communities. So I think that's what, as researchers, we need to thrive, that we answer questions that are important to people who are facing these challenges on a daily basis, not what it is available already.
So really thinking about listening to people, listening to kids, listening to communities, listening to teachers, and making sure we don't lose focus on our most marginalized populations, not just because it's ethically the right thing to do and folks matter, but also because it matters to the system, right? Like, it matters to our overall system design. And then going all the way up and saying, if this was to happen again, we need to think about access to internet, technology, green spaces, access to healthcare. And then also, how do we replace that really essential thing we've learned? I think we've known, educators know this about school, but the rest of us have really understood, which is the really essential part of schools in promoting social and emotional well-being. And that if this was to happen again, we have to think, how do we actually meet that gap? How do we actually support kids in those skills that they were getting in school and they weren't necessarily getting when we closed schools? Yeah. So I think in the last minute, I want to thank you again so much. It's been great to be here with you. It's been sort of nice. The light's gone down as we've been talking, and I can kind of, be here with you. And it's so nice to also pause and take time to think about kids' mental health together. And also, if you're listening and watching, thank you so much
for joining the event today. As we mentioned at the beginning, the event will be posted to the Dalla Lana School of Public Health and the Institute for Pandemics YouTube pages. There will be closed captions on that. I've been told I speak very fast, so I hope that will help you. And you can also stay in touch by following the Institute for Pandemics and the Dalla Lana School of Public Health on their social channels on Twitter, LinkedIn, Facebook, and Instagram. It's been wonderful to be with you, and we hope to be with you again soon at future events.